Welcome back to West Texas View.
Welcome back to the West Texas View. Dr. Melinda Morris from the Texas Tech University Health Science Center is our guest today. She's board certified in obstetrics and gynecology and also in clinical nutrition. And we have been talking to her about some of the questions that were called in since she first appeared on the program. And this question that we're discussing now was a person called in and said, what's the effects of alcohol, smoking, and drug use and other bad habits when you're pregnant, and what does this do to your child after it's born? And one of the things just before the break we were talking about was alcohol syndrome and how that really makes a long-term difference in the brain of a child.
And, and these children have developmental delay, where their development and their progress is just delayed over time. So, that's a very severe adverse, and it's preventable. Smoking also has an adverse effect on pregnancy, and unfortunately, so many young girls are smoking. But smoking has an adverse effect on the vascular system, the blood supply. Cigarettes are full of toxins, and it can increase the risk for miscarriage. It can increase the risk for stillbirth. It can increase the risk for growth restriction to where the baby isn't growing appropriately during the pregnancy. So it has a lot of adverse outcomes on pregnancy. And I've been amazed at the degree of drug use in the young obstetrical population as well, which is very sad. And we do drug screening on any obstetrical patient that has a past history of drug use. And when she delivers her baby, she's screened again for drug use, and even the baby is screened for drugs. And if the baby tests positive with drugs after the delivery, then Child Protective Services is actually contacted. So they've got to realize that these drugs are passing on to the infant, when they're using them during pregnancy. So very, very adverse effects.
And you wonder why anybody would get pregnant and bring a child into the world knowing that they're giving them a disadvantage to begin with.
Yes.
Disadvantage brain-wise, disadvantage health-wise, lifetime-wise. They're going to have some effects.
That's why education is so important, because unfortunately some of these girls don't realize the adverse effects.
And we preach it on their bodies, but when they're being irresponsible and foisting their bad habits on an unborn child, it just seems like it's double bad.
Yeah. Well, that's why Child Protective Services
gets involved.
Yes,
but once the damage has been done, it's been done. Yeah. Another question that was called in was about endometriosis.
Yes.
And what it is and how and why did I get it? And that was a person that had just been diagnosed with it, and even she didn't understand the explanation that she got.
Well, an endometriosis is a difficult disease to understand. I mean, even in the medical profession, it's a difficult disease to understand because there's such a wide variation in symptoms, outcome, adverse effects from endometriosis. And even today, we don't totally understand why some ladies develop endometriosis and some ladies don't. It tends to run in families. So if a mother had endometriosis, there's an increased risk that her daughter's going to have endometriosis. So we know there's some sort of genetic, tendency towards endometriosis. What endometriosis is it's an implant of the tissue that's normally inside the uterine cavity that's sloughed off with your menstrual cycle each month. That tissue becomes implanted within the abdominal cavity. So it's implanted where it doesn't belong. And so it's tiny implants of this tissue that normally would just be sloughed off with the menses each month, but it may be implanted inside on an ovary, around the fallopian tube, on the surface of the uterus, in the peritoneal lining, the lining around the uterus, where it doesn't belong. But this tissue is hormonally active. and it actually bleeds and hemorrhages every month, just like the rest of the tissue is responding to hormones every month. And because it's in a location where it doesn't belong, it creates inflammation in that area. And so the body responds to this tissue being there that really doesn't belong there. And over time, it causes scarring, adhesions, pain. It's associated with an increased risk for infertility, where it's more difficult to get pregnant. And it can cause very debilitating symptoms in women. You know, some of the symptoms that, you know, you suspect that a lady may have endometriosis is that she'll start developing pelvic pain a couple of days before her cycle, because this tissue is actually starting to respond to some of the hormone changes. And so, you know, even before she starts her cycle, she'll begin having pelvic pain. And then when she has her cycle, she has severe pelvic pain. You know, so a lot of the pain is associated with the cycle initially, but over time, as more scarring, adhesions, the disease process continues, it can get to the point where these ladies have continuous debilitating pelvic pain on a regular basis. And
so, what is there any way to prevent that? Can you drink more water to keep it from, to wash it on out, or?
Well, you know, ladies make two types of hormones. They make estrogen and progesterone. The progesterone hormone tends to suppress that tissue. So one way that you manage these ladies is that you can put them on a continuous progesterone therapy. Anything that'll help keep them from cycling and keep them from bleeding can help keep the symptoms under control. When ladies become pregnant and they don't have a cycle for 9 months, their symptoms of endometriosis goes away. Because they've had high progesterone levels from the pregnancy and they've had no menses for 9 months. As soon as they deliver that baby and they start having regular cycles again, their symptoms come back. And so in a lot of ways, you almost try to induce a false pregnancy state with continuous progesterone therapy. You try to keep them from having cycles, because if they're not cycling, they're not bleeding, their symptoms are improved. You know, when ladies go through menopause, the symptoms clear up and go away because they're not having cycles anymore and their hormone levels are low. So there are things you can do, you know, if it's progressed, I mean, there's different stages of endometriosis, and if it's progressed to stage 4, where there's just severe adhesions, pelvic adhesions, severe chronic pelvic pain, then a complete hysterectomy is your ultimate treatment. But you hope you don't have to, progress to that point.
Yeah. We're going to be back in just a minute and continue this conversation.
Stay tuned. West Texas View will be right back.